Welcome to another upper cervical clinical case review by our host, Dr. Chris Brown. Today, I'll be going in on a reflex sympathetic dystrophy, or a CRPS case that I had a person that I managed a couple years ago who had just had a cholecystectomy, a gallbladder removal about 2 weeks prior to seeing me. And her whole body was just in a full-blown RSD CRPS type flare-up. So for those who don't know what reflex sympathetic dystrophy is, or chronic regional pain syndrome, or have experienced it and are watching this video to be like, why is a chiropractor talking about this? Well, that's what this video is going to explain. Just to kind of preface this, in our clinic, in the upper cervical world, we specialize in nervous system function, particularly autonomic nervous system function, the difference in the dichotomy between sympathetic and parasympathetic. So autonomic means automatic. That's the unconscious mechanisms in our body, our blood pressure, our temperature regulation, our hormones, our digestion, our mood, like those things that are occurring in our body that are automatic, that we don't have conscious control over. Those are governed by our autonomic nervous system, which has receives a big influence from our brainstem and the top bone of our neck. So those are just very superficially how we can kind of connect some dots between what we take care of here, which are those top two bones of the neck, and what we are addressing here in our clinic. I'm gonna get my bones real quick. All right, I'm back. So I had this person reach out to me. She had actually seen a massage therapist who specializes in neuromuscular massage therapy. And she had reached out to me saying, hey, I got a person for you. I think that you can help. When I was addressing what she was talking to me about, she said that she was having like burning, like spasming, almost like tingly, like vibrations, like full body. And the massage therapist said when I was touching her neck and her body, her muscles were reacting in ways I hadn't seen before. And I was like, you need to go see Dr. Chris. And so this person reached out to me and she kind of explained her history, what had been going on. She had just had a gallbladder surgery about 2 weeks prior towards getting into the clinic. And she had a pretty significant reaction to iodine contrast for her CT scan, I believe. And so her body reacted very unfavorably towards the iodine. It also reacted very unfavorably towards the anesthetic that was used during the surgery and it was basically a big, huge chemical stressor. Back to back, that kind of compounded on each other. And things that really spaz our nervous system out, and especially our central nervous system and our autonomics, are three categories: physical stressor, chemical stressor, emotional stressor. Majority of us are experiencing all three to a degree all the time. Physical stressor, the easy explanation for that or example of that is like a car accident. Just getting your head, getting boshed like that can really irritate, cause some damage, injury to the upper neck. The upper neck protects our brainstem, which has all of the regulatory control centers for our body. Essentially, it's our human fuse box, if you will. It's got our digestive centers, our heart, our sleep centers, cardiorespiratory centers, vasodilatory centers, hormone centers, sleep centers, mood centers, you name it. It's located in the brainstem, which means function of the brainstem is of the utmost importance. So this woman here that reached out to me, she had been basically like on her pain diagram, she had this like the numbness and tingling over her entire chest and abdomen and both arms and both legs. So it was essentially like full body, like she described it as vibrations that wouldn't turn off. And it was almost like her body was just like on edge the whole time. It was as if like the chronic regional pain syndrome was body-wide versus just a region. And so with reflex sympathetic dystrophy and chronic regional pain syndrome, those are synonymous. Those are the same thing. Basically, it's characterized by extreme like nerve pain located in an area following an injury, a surgery, or a stressful event that shows up negative on imaging and tests and blood work. So there's not really an explanation, structurally speaking, that provides reasoning for the symptoms that the person are experiencing, but obviously they're experiencing a really serious issue. It's like they're not just having phantom nerve pain in their leg after they fell off a horse or in their arm after getting an injury. They're not fantasizing that. But a lot of times doctors will say there's nothing we can do about it. Here's some pain meds to try to help manage it. But it's nerves that are firing chaotically. It's nerves that are sending pain signals to the brain, and the brain just perceives it as pain when there's not actual structural damage going on. And in her case, the toxin from the anesthetic and the iodine had spazzed her nerves out so much that they're firing those signals to her body, to her brain, and that caused a massive amount of stress on the nervous system. And when we have a massive amount of stress on the nervous system, the body typically will respond as if there's a fire alarm going off. So when the body receives input that there's a big stressor going on, whether it's external or internal, body's going to respond in a fire alarm-like sense. So imagine a fire alarm starts going off in the clinic right now, be-doo, be-doo, and it's super intense and loud. Well, what's going to happen to my heart rate? It's probably going to go up. I'm probably going to start to panic and say, I need to get out of here. I got to go. My heart rate's going to go up. What's going to happen to my blood pressure? It's also going to go up. What's going to happen to all the muscles in my neck and my shoulders? It's going to get all tight and tense. They're going to really fire up and get me ready to boogie out of here. Well, those same mechanisms occur when we have an internal fire alarm going off as well. And the baseline internal fire alarm that can be going off as just like a faucet dripping in the background is when there's pressure on our brainstem due to a misalignment of either the first or the second bone of the neck. If my fist is my brain and my thumb is my brainstem, which I mentioned earlier is like the fuse box of the human body, the brainstem sits in these two bones like this, just like so. And you can see there's a nice big circle here. Try to have it by my shirt so you can kind of tell. There's a big circle right in here. That's where our brainstem sits. And it's also got ligament connections towards this part of the bone that's lining this spinal canal right here. And if there's any misalignment of these two bones or rotation, it'll put torsion on the brainstem, putting pressure on it and causing dysfunction output. It'll be chaos in, spasm brainstem out, chaos out. And in that event of, especially her surgery, that's a big, huge physical stressor. Also a chemical stressor because of the anesthetic and then the sequential iodine as well. And an emotional stressor because going in, getting told the news of surgery, getting prepared to go into surgery, getting the surgery itself is a bit, and then the aftermath of surgery is a big emotional stressor. So she had a compound of all three to where her stress load was super, super high in her body. Her stress tolerance, resiliency to stress was really, really low. And so she had this huge gap. And what we want is we want to have a low stress load and a really high resiliency to stress. So then that way when everyday stressors come in, they don't spaz our system out. Most of us are living like this, where we have a high stress load, a low tolerance to stress, and any stressor that comes in just exacerbates whatever symptoms we're experiencing. So in her case, for about 2 weeks, she was having these full-blown, full-body spasms. It was like her abdomen was shaking and tingling, her arms, her legs. She felt like she couldn't do anything. She also had super intense brain fog as well throughout the day, just like a cloudiness and a grogginess that she couldn't really shake. And she also had palpitations and wheezing, like asthma-esque. She also gets some headaches sometimes. She also had anxiety from the surgery and the shakiness that she'd never experienced before. And she also had neck pain as well. So those are the main things that she had going on. And when we have this regional or reflex sympathetic dystrophy, chronic regional pain syndrome, those nerves aren't actually damaged, but they are firing in a way as if they were. And typically that's due to a big stressor in the system. In her case, it happened to be chemical. It happened to be the anesthetic and the iodine that her body wasn't able to flush out because her body was in such a stressed state due to the chemical stressors, due to issues going on with her upper neck, which we confirmed on our functional nervous system test, which I haven't gotten into yet. But with all of these stressors going on in her body, her immune system was essentially kind of shut down, and her body wasn't able to clear out and get rid of the anesthetic that was in her body, and it just kind of left to linger. So when she got here and we were able to run a functional nervous system test on her, that's always step one for us, is we need to run a functional nervous system test. We need insight, objective data towards seeing what's going on with the central nervous system. And then that way we're able to make a judgment call. Are we the right place for you? Do we expect to get results? That's step one. The test itself, it is a scanner that it looks like a Walmart scanner that will run up, that we will run it by hand up the back of a person's neck, and it will give us a graph on the computer that will show 3 lines. Very similar like how an EKG measures heart function, this measures nervous system function. And it gives us insight into how much stress is on the nervous system and how well the brain and body are communicating. The reason that's all important, which I probably should have started this video with, but if you watch all the other videos, this topic will be on there too. The main reason for this and the importance of this is that our nervous system is the connection point between our brain sending the healing codes and our body receiving the healing codes. So our body is a self-healing organism. It's able to do that day in and day out, if in position to do so. Those healing codes come from our brain and are communicated, conveyed through nerves, reaching all cells, tissues, muscle, organs in our entire body. We cut open our knee playing capture the flag, it scabs up and goes away. How? We strain a hamstring playing soccer, it heals up and goes away. How? We will have some kind of health issues. We start cleaning up our diet and it'll go away. How? It's because our body is able to integrate all the things we're doing for it and allocate those resources to the areas that need, so that way that I can get healed up and we can keep moving forward. Those healing codes are created by our brain, communicated through nerves, making brain-body communication of the utmost importance for the capacity of our ability to heal itself. Healing comes from sleep, comes from our brain, communicated through nerves. If there's anything interfering with that brain-body communication, aka a misalignment of the upper neck, then it makes sense that chronic health issues will stack up over time if there is a misalignment, because the brain's healing codes are not getting out to the body. It's getting stuffed up in here. It's like the brain gets congested, the body starts starving of the healing codes, and our body just gets stuck, and we start getting chronic health issues accumulating over time. Instead of the faucet just being ripped open and a full flow of water, it's like a drip of a kinked hose just oozing out. We want that to be an open flow faucet. So in her case, what we did was we ran some of those nervous system tests, found some stress in the nervous system that clinically indicated that there was indeed a misalignment of either the first or the second bone of the neck, in which case we didn't know what that was at that time. We needed to take x-rays to identify what that is for her. On x-rays, we do motion x-rays, because when the nervous system is stressed out, it's due to a misalignment, but it's more so rooted in incorrect movement of these 2 bones. So we take x-rays, motion x-rays, to reveal that movement. And we are analyzing these 2 joints up here of the first vertebra, and also these 2 joints here of the second vertebra. And there's only 4 joints. It doesn't seem that special, but there's 276 different ways that those 2 bones can misalign. And we were trying to figure out the one that will take care of all the other combinations of all the other bones. So in this person's case, we found out that the top bone of her neck was not moving in either direction, And also her second bone was not moving from left to right. So basically whenever she moved her head, either left or right, she had some kind of incorrect motion or lack of motion in that upper neck, which will then cause a lot of torsion and pressure on the brainstem because we're always moving our head around. So we need those bones to move around freely so that way our brainstem is able to take in all the information appropriately and not be stressed or spazzed out. But if we don't have that correct motion, then our brainstem is going to be getting fed with a lot of chaotic, incorrect input, and then that's going to lead to chaos out that we experience as symptoms. In her case, she had a more of a gradual detoxification process, which I kind of anticipated given that she had just had surgery like 2 weeks ago and had that CT with iodine a week prior. So her symptoms, she was not a case of stuff clearing up immediately. I've shared a few of those in prior videos, and those are not the norm. Those are more so the exception, and it's always very humbling and eye-opening when those occur. Typically, people have more of a longer runway because nerves take a while to heal. Nerves are not on the same timeline or same ballpark as bones. Having like a 6-week healing process or ligaments, having a 12-week healing process, nerves really take like 4 to 6 months. They just heal really, really slow. And hers was, her whole body needed to detox from this anesthetic and this iodine that she was allergic to following the surgery to allow her body to start functioning normally and start regulating temperature correctly and to start have nerves firing correctly and blood pressure, because all of those were so chaotic essentially from the toxin of the anesthetic that was causing that vibrating sense, that full wide like burning, tingling numbness almost that she quoted as vibrating. She said it feels like my body's vibrating all the time, kind of a burning, itching feeling, and I can't get it to stop. It keeps me up at night. It was mainly in her torso, so in her abdomen, which is where the surgery was at. And she couldn't shake it. It would freak her out. She'd also wake up with super bad brain fog. And she started noting very, cognitive improvements, if you will. Probably around like 6 to 8 weeks in, she started kind of notice, okay, the vibration is getting less. Okay, went the other night without having that vibrating. Okay, it's been a few nights since I've had the vibrating. It was a slow kind of turnaround process. It wasn't an immediate, it's all gone. That's not how the stuff works. We're not in the game of just getting rid of symptoms immediately. We're just in the game of putting your body in a position to function correctly, which when it is, that means the body is going to start healing appropriately. And then we just let the body run its course. And we check and monitor and maintain that healing capability. If this person shows evidence of her body not being in a place to heal, dictated based off scans we run every single office visit, then that is when an adjustment is warranted to restore that function once again. And then we get back on the road towards reducing our stress load, increasing our tolerance to stress. In her case, her immune system was very compromised because of how overactive her sympathetic nervous system was, which is her stress side. And when that aspect of our nervous system is really fired up, our immune system will get suppressed. And our immune system, along with like our liver and more of our digestive style organs, those are the ones responsible for filtering out toxins. And hers, that whole basic like pathway connection points were just shut down. They were essentially inhibited due to the amount of stress on her body, chemically speaking, which neurochemically speaking, and in addition, the amount of stress just on her nervous system being stuck in the stress mode. The stress mode is sympathetic. So when we were able to get her out of stress mode, which is called sympathetic, and get her back into parasympathetic, then her body was able to start regulating itself again. We're able to start having those healing mechanisms start whirring back up again, almost like a factory that had been dormant for a while and the gears start turning again. And then her immune system was able to start functioning again. And then her immune system was able to start flushing these toxins out through waste products, and we're able to start getting this stuff out of her body, out of her system. And then she was able to start living life the way that she had remembered. And she was a super active person. She ran a bunch and stuff. She was actually a nurse practitioner. So she was also managing patients, and she was going to school during the time. So we're like, she was unable to study for tests because of what she had going on. So that was the whole mission of care was, well, I'm not worried about the vibrating or the symptoms that you're having. Like, we need to get you back to a place where you can study, take your exams, get your doctorate, and start, playing a role in health care. And we were able to achieve that. I say we, I really mean she, because she did all the work. She showed up, her body healed herself. I didn't do any of that. All I did was just check and monitor if her nervous system was in a healing state or not. And when we do that, a lot of good things happen, because there is nothing that mankind has to offer that has a greater healing capability than what is already contained within our brain. All that healing code, all it needs is just to be unlocked. And unfortunately, medical studies are showing that about 90% of people are living life with a misalignment of either the first or the second bone of the neck, which also means that 90% of people are living life with their healing capability shunted and constricted off, and they aren't getting that checked. So the best thing that, if you're watching this video, that you could do is just look up, see if a doctor near you has access to this functional nervous system test. It is called computerized infrared thermography, aka Titron. Asked to be able to get that scan done just to see how your nervous system is functioning. And that is easily the best thing that you could possibly do for your health, vitality, and longevity for you and your family. Please find that test. It should be in hospitals worldwide. Hopefully by the time I'm done living, it will be, because it's the most important test we could possibly take, 100%. So with that being said, thank you for tuning in. Please check out some of the other videos. I've seen a myriad of cases that have responded very favorably towards upper cervical chiropractic.